Bribery and fraud was the center of an investigation 3 years ago that put gravely ill diabetes patients in jeopardy. Now in 2021, the treatment some called a scam is being reviewed again here in San Diego, and a local doctor is facing charges before the state medical board. The treatment in question was an insulin infusion procedure used at facilities called Trina Health clinics in several states. The San Diego doctor under investigation had his own Trina clinic, which colleagues called worrisome, saying it preyed on people's vulnerability. The doctor's name is James Novak, and joining me now to talk about what he did and to break down this story is investigative reporter Mary Plummer. Mary, thank you for joining us today. First of all, what is Trina Health and how did its founder get in trouble?
Trina Health was a nationwide chain of diabetes clinics that our former reporter Cheryl Clark investigated back in 2018. The founder of Trina Health is a now disbarred Sacramento lawyer named G. Ford Gilbert. He ultimately was indicted and sentenced to federal prison, and he was accused of a pay-to-play scheme in Alabama. It's quite a fascinating story. It was related to trying to get legislation passed to require an insurance plan there to pay for the Trina insulin infusions. This is a treatment that many viewed as a scam. In our investigation, we spoke to more than a dozen diabetes specialists who questioned the scientific evidence behind the treatment. Most described it as a waste of patients' time. It was a lengthy treatment, took about 4 hours. And some of these treatments were happening here locally in San Diego. Dr. James Novak, who you mentioned is facing charges before the state medical board, was doing these procedures at his clinic right here in Pacific Beach.
So Mary, this Dr. Novak was doing this treatment some called unproven. What was his role in all of this and what charges is he facing?
Dr. Novak is accused of repeated negligent acts in 2017 and 2018, failure to maintain accurate medical records, and unprofessional conduct. Those charges were brought by the executive director of the state medical board. Novak declined to comment through a staff member when I called the office for this latest story. But a few years back, he told us that his Trina clinic had about 25 patients a week. At the time, he said the majority of people got enough benefit from it that they elected to keep coming, but not all patients were happy. Here is a clip from a 2018 story we did interviewing a patient of his clinic. Her name is Megan Lynch. She said she would come home from the treatments and collapse, and that the treatment spiked her blood sugar levels dangerously high.
I was scared because I was so sick. I had no energy, and just on a day-to-day basis, I did not feel like myself, and I couldn't pinpoint it to anything. I just kept thinking, your diabetes is still out of control, and now you don't have any doctor to really share this with and to really look into this with me.
So Mary, what are the next steps here? Is he still practicing medicine and seeing patients right now?
I can tell you that he appears to still be active. Yelp reviews from recent months range from 1 to 5 stars. I spoke briefly with his staff for this story, but they did not return a voicemail asking whether he's still doing this insulin infusion procedure. We certainly ask any viewers out there who have tips to reach out to us. Our contact information is at our website, inewsource.org. And in terms of what's next, the state medical board could revoke his license or put him on probation. It's up to them. The next step will be a hearing, and then after that, Jesse, a decision will be made.
Mary, I'm sure this is something that you're going to continue following as it moves along. Mary Plummer, investigative reporter. Mary, thank you for being with us today.
Thank you.